Flush your dookie down, you flush away the answer.
Hello, long time no see. Dr. Sil here, Junior Doctor from Sydney, Australia, and we're doing another episode of Scrubs. Probably one of the most recommended episodes, my musical. I think it's season 6, episode 6, if I'm not mistaken. And yes, I know I haven't done videos for a little while. It's because I have been traveling overseas and I've been doing other sorts of videos. Not exactly the Scrubs reaction videos, but other types of content like podcasts and interviews. So if you're interested in me interviewing other doctors, make sure you check out the Doctors Getting Coffee podcast that I started, because that's been it's been really, really interesting for me to do. But unfortunately, it has meant that I've missed out on a couple of Scrubs videos. So I've got the day off. I'm here to hang out. Let's watch some Scrubs. So if that sounds good, let's get into it.
JD, I'm gonna get a drink from the water fountain. You wanna come?
Please, Elliot, I'm not that desperate. Although I am a little parched. Plus, I could hold back her hair.
Boom. What do? Doctors, ABCD, first aid. That's for, civilians. Dangers, response, send for help, airway, breathing, CPR, and get a defibrillator ASAP if someone's unconscious. But as doctors, you need to remember your A to G assessment, which is actually pretty similar. But yeah, you got to do an A to G.
Are you okay, ma'am?
Oh, she's conscious.
Do you see?
Call 911 emergency. Why are you singing? Wait, why am I singing?
Boom, temporal lobe stroke. What's the bet? Or temporal lobe epilepsy. You can get weird neurological phenomena when you have seizures in the temporal lobes. You might hear people singing, you might speak a second language, you can have weird things like this. So that's what my money's on. She didn't have any tonic-clonic, she just had a collapse. So weird how there was no phenomena of a seizure. What you would expect if someone had a tonic-clonic seizure, also called a generalized seizure, previously called grand mal seizures, but we don't do that anymore. It's just generalized seizures. You lose consciousness. You usually have a tonic phase, then a clonic phase. So tonic, it's arms go up, and then clonic, it's shake, 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 shake. Sometimes one side more than the other, and usually they last less than a minute. Everyone always panics when someone has a seizure. Don't panic. Just roll them onto their side and call an ambulance, unless they have known epilepsy, in which case they might have a special seizure plan for them. But if you don't know, just call an ambulance. You can't go wrong. Anyway, she's conscious, so this is a focal seizure, and she's hearing singing, so it's maybe a temporal lobe seizure where she's hearing things. Anyway, let's find out.
Is there someone here with you?
Someone that we could talk to.
Are you okay?
Are you alright?
Are you okay?
Are you alright?
The minds are free.
So when someone's unconscious, what are they doing driving the ambulance? Anyway, when someone's unconscious or has a medical event and you need to assess their consciousness, you do a GCS, which usually, so you want to assess for eyes, motor response, and verbal response. So EVM in that order. So eyes, verbal, motor. And it's out of 15, and the lowest is 3, not 0. Anyway, that's the scoring criteria. But essentially, if someone can open their eyes spontaneously, speak to you and make sense, and follow instructions. So saying, "Are you okay?" and they just go, that's like a GCS 14. That's not 15. That's not fully conscious. They need to use words, and they need to follow an instruction. Like, can you hold my hand? And they have to reach and grab your hand. Just don't do it on the side of weakness if there's a stroke or something, because then they can't follow the instruction.
Key thing, Elliot. Maybe she does hear singing.
Yeah, well, I haven't sung since the 6th grade talent show when I did Pat Benatar's Hell is for Children. And then afterwards, Mr. Shemin, the MC, said, no, actually, hell is for everyone who just had to hear you sing that song. My mom was so mad she slept with him and ruined his marriage.
Hello, I'm Dr. Kelso. I'm delighted that you came. So the doctors say you fainted and you don't know what's to blame. Well, put your mind at ease. There's no ill we can't outsmart. On behalf of all who work here, welcome to Sacred Heart.
Our facilities are excellent. You couldn't ask for more.
As long as you avoid the bathrooms on the 2nd floor.
This is Dr. Cox. I'll be giving him your chart.
And that's Dr. Kelso, the kiss ass of Sacred Heart.
You
say you burned your hand, real bad, we'll fix you up with gauze.
Perhaps you need your fat sucked out or want a smaller schnoz.
Hey,
Caught an STD from some tasty little tart. We swear we won't judge you here at Sacred, here at Sacred, here at Sacred Heart. One more thing that I should mention, if what I've heard is true, and everyone appears to be singing to you. Your case is very serious, and we'd better start, 'cause if you think we're singing, you belong at Sacred. Doctors, nurses, patients, dead guys, welcome to Sacred.
Wow. They're so good. I think the only thing I have to feed back to them is don't spin someone who's having a partial seizure as a good rule. Is he smoking? Oh, it's a lollipop.
I can't do this all on my own. No, I know I'm no Superman. I'm no Superman.
so Mrs. Miller passed both audiological and neurological exams. We cannot find anything that explains why she's hearing music.
Oh, that is weird, because if she was having a partial seizure, one of the neurological, I mean, he called them exams, but investigations would be a EEG, an electroencephalograph, which is all those dots you put on, the head of someone, and you try and see if they're having seizure activity, which will look different to the normal brain waves in the areas that aren't having a seizure activity. The ECG is the heart version of the EEG, which is what you put on the head to look for seizures. You put the ECG on the chest to look for heart attacks. And there should only be one real pathway through a heart for its contraction. It's complex, but you can understand it after a bit of study. But yeah, the EEG is bonkers. It's so hard to understand.
How about this for an explanation? She's cuckoo pants. Run some more tests, interpret a psych.
Hey, Miss Miller, we just need a stool sample.
Why do you need a stool sample if you think I'm just a nut?
So, a quick point. What psychiatric symptom would this be? Answer, not auditory hallucinations. I'm sure a lot of people would be like, oh, she's hearing singing. That means she's hallucinating, so it's schizophrenia. No, not necessarily. And what's happening here is she's getting an auditory stimulus, which is real, which is the sound of people talking. But the interpretation in the head is incorrect. So it's not a hallucination where there's a made-up stimulus. The stimulus is real. People are talking. But so the point of illness is not in the perception of a stimulus. It's in the interpretation of that sensation. So that makes it an illusion. So this is an auditory illusion that she's experiencing, which can happen with some psychiatric illness. And there's a bit of a thing here, like, well, maybe she's like, they're talking about it as if it's like less important because it's not neurological, which is a horrible thing to do, really. Like mental disorders, even though we don't have good tests for them, are just as neurological disorders. They're problems in the pathways of the brain that are so difficult to understand that we just don't have the ability to investigate them in more accuracy. So we are left with just looking at the behavior of people and trying to treat the behavior. Massive problem in psychiatry. One of the reasons I want to study psychiatry, and let's keep going.
'Cause the answer's not in your head, my dear. It's in your butt.
You see, everything comes down to poo. From the top of your head to the sole of your shoe, we can figure out what's wrong with you
Parasites?
by looking at your poo.
Turk,
Do you have a hemorrhoid or is it rectal cancer? When you flush your dookie down, you flush away the answer.
It doesn't really matter if it's hard or if it's loose. We'll figure out what's ailing you as long as it's a deuce. Yes! Everything comes down to poo.
Everything comes down to
Cardiovascular and lymphatic, yes, the nervous system too. All across the nation, we trust in defecation. Everything comes down to poo.
If you want to know what's wrong, don't sit and act so cool. Just be a man and eat some bread and drop the kids off at the pool.
Hey,
My stomach hurts.
Check the poo.
Sprained my ankle.
Check the poo.
I was shot.
Check the poo.
A homeless guy threw poo in my eye.
Check the poo.
Mine are his.
First him, then you. It may sound gross. You may say shush, but we need to see what comes out of your tush. Because everything comes down to poo. Whether it's a tumor or a touch of the flu. Please won't you pinch us off a big fat clue?
Our number one test is your number two.
If there's no breeze, light a match, please. Everything comes down to doo-doo, 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 doo-doo. Everything comes down to poo.
that song was awesome. Putting it on my Spotify playlist for sure, but it's not true. It doesn't come down to your poo. That's rare. I mean, on a day-to-day basis, the only poo tests that I order really is a feces MCS, which is to look at the bugs in the poo if someone has diarrhea. And I can tell you if someone's got like a really nasty infection, like a C. difficile infection, which you can get if you've had antibiotics, and then the Clostridium bug which stays in your gut as spores explode, and you get it's a horrible diarrhea to have, really, really bad, and you need really strong antibiotics for it. Or it tells you if you have other less scary but still, problematic bacterial causes, and you can also do a viral swab on the poo. I'm trying to think of other things I do on the poo. Another useful test is fecal calprotectin, which is a pretty unique test that I would never really commonly order, but I know they do it often for people with inflammatory bowel disease, and that shows the inflammatory state of the bowel. But yeah, no, not everything comes down to poo, especially if you get shot in the arm. Yeah, not much value in a poo sample in someone who's been shot. First, control the bleeding. Such a good song, though.
We are running a test that's a waste of our time, but at least she'll accept that she's medical.
Okay, first of all, this is an MRI room, so no metal, including no stethoscopes. All right, do you know what happens when you bring a stethoscope into an MRI room? Phew! It could kill someone. So anyway, this is an MRI room. First of all, a bit more. When you're outside of the MRI room, they'll put you in a head girdle, which is extremely claustrophobic. So often I'll have to go and give them some midazolam to help chill them out a little bit, little smidgen, little 1 milligram of midazolam IV. Ooh, that's gonna calm you right down. You'll be like, hey, let's go for an MRI after that. Then you strap in, earplugs in, and then you're stuck. You can't move, and it's very claustrophobic. But it's only 30 minutes, so yeah, we put you in the MRI machine. It goes woo 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 woo, very very loud. It's a horrible sound, the MRI machine. I'm not jealous of anyone who has it, but then you get cool pictures of your brain, so that is a benefit. Anyway, that's what it's like to get an MRI of the brain.
Medically fine, she'll admit that she's nuts, or I'll have to say snore. Just give her the CAT scan and show her the door.
While we process your results, we'll take you back
it's done.
to wait.
We've got drugs to calm you down so you don't stress about your fate.
It's best to know the truth. Of that we have no doubt. But you'll have to face the future.
When the truth comes out.
You're gonna miss the car.
This is very Les Miserables in terms of the song sounds.
You're gonna miss it round here. Gonna hurt him badly. But you can't stay away for one whole year.
I know that I'm not crazy.
Everything comes down to
I hope that I'm not crazy.
when we move, I'm gonna have my own private loo.
Oh, how am I supposed to tell him that he's not moving too? Oh my God, he doesn't have a clue. I'm crazy.
If you'd like to reconsider, I'd be glad to do my part. If you want, your job is open. Come on back to Sacred Heart.
Look at the temporal lobe. That could be why she's hearing music.
Temporal lobe.
Aneurysm I've ever seen.
Ah, no.
Sometimes you're better off not knowing.
Aneurysms are bad. What's an aneurysm? An aneurysm is a dilatation, outpouching growth of a blood vessel that can pop and kill you. So, yeah, if you have an aneurysm, hopefully it hasn't started to bleed, right? That's number one. And then number two is you probably need to get a coil in it, depending on its size, where a neurointerventionalist will go through an artery, maybe in your groin or in your arm, and place a metal coil in it to seal it off, which is very cool and can save someone's life. But it's high risk surgery. You know, there's complications that happen with, you know, I've heard of patients. Yeah, anyway, it's bad luck. Sometimes you just have genetic, you know, problems with the quality of your blood vessels. Not your fault.
But this isn't one of those times. Your world's become a musical, and your doctors speak in rhymes. It's best to know the truth. Of that we have no doubt. But you'll have to face the future.
How can I tell him?
How can I tell him?
How can I tell her?
You'll have to face the future when the truth comes out.
So, Dr. Cox, is it serious? Oh.
When the truth comes out.
Okay, we have to tell them.
They're so close, maybe.
You know, on the topic of breaking bad news, the other day I was with a patient and he had some abdominal pain problems, and we had to end up doing a CT abdo for it to try and identify if he had a large bowel infection, colitis. And one of the things that happens when you do imaging of like a CT abdo is you pick up on incidental findings where you get a little surprise somewhere where you weren't looking. That's what happened. We found something on the pancreas. Man, it's not good to have problems with the pancreas, you know. So that was hard to break to him, and you know, there's a lot of uncertainty, but the way that it looked, it did not look very friendly. So what do you do? So I sat him down. I said, look, we were looking for this. The good news is you didn't have the bowel infection we were worried about, but the bad news is we pick up on things when we do these tests, and we picked up on something, and you'll have to have it investigated with your GP, and at the moment we just have to sit with uncertainty, and hopefully, yeah, we don't know. We don't know. That's the problem. Anyway, we will see. We'll see what happens. But yeah, that's sad.
We'll be friends forever. We're gonna be friends forever. We will always.
Oh, it's very Grease Lightning.
Friends forever. We're gonna be friends forever. I'll always be there for you. We're as close as
The vena cava and the aorta.
we're best friends, just like
Amoxicillin and clavulanic acid.
Hey!
The left and right ventricle.
A hypodermic needle and a latex tourniquet.
Diverticulitis and a
Randomus.
The vena cava and the aorta.
Amoxicillin and clavulanic acid.
All right, let's go through the vena cava is a major vessel that brings blood from the body, and the aorta is the major vessel that brings blood to the body, and they run right next to each other just before getting into the heart for the inferior vena cava. So they're very close. And then I think the next one was amoxicillin and clavulanic acid, which are actually a combined drug to make augmentin duo fort, which essentially amoxicillin is a antibiotic, breaks down the cell walls of bacteria. And when you add on clavulanic acid, it helps stop the bacteria from making enzymes and proteins that denature or weaken the antibiotic. So bacteria are amazing, but bacteria are amazing because they create defenses against antibiotics, and the clavulanic acid impairs those defenses. I didn't hear the other ones. I think one was a hypodermic needle and latex gloves, which I guess is just
The tibia and the fibula, the left and right ventricle.
the tibia and fibula. That's the two bones in the leg. They're very close. Let's hear what the next ones are.
A hypodermic needle and a latex tourniquet.
Oh, hypodermic needle and a latex tourniquet. So you put the tourniquet on, and the needle goes into right below the tourniquet. Okay, what's the other one?
The vena cava and the aorta.
Amoxicillin and clavulanic acid.
Tibia and the fibula, the left and right ventricle.
Oh, left and right ventricle was the last one. It's just the two bottom parts of the heart.
What does the future hold? So many things that I put off. assuming I'd have time, assuming I'd grow old. What's going to happen? And will I be alive tomorrow? What's going to happen to me?
You're going to be okay. That's what's going to happen. Everything's okay. We're right here beside you. We won't let you slip away. Plan for tomorrow, 'cause we swear to you, you're going to be okay.
I'm going to be okay.
That's what's going to happen.
Everything's okay.
Everything's okay. We will never leave you. Right here we will stay. Plan for tomorrow, 'cause we swear to you, you're going to be okay. We hope.
Gosh, I've been feeling that the assumption of growing old, when you're a junior doctor, when you're like a medical student and junior doctor, you always say it's going to be okay. You always say what Dr. Cox was saying, but you see a couple of young people die and you're like, fuck, like sometimes it isn't okay. Sometimes you don't grow old. That's really hard and makes you appreciate your life.
Did it work?
You're gonna have to tell us.
Thank you.
By the way, who's the best singer? You know, like in your head. Don't let the fact that I went to theater camp affect your decision. In musicals, there's always a happy ending.
So sorry, it's a neurointerventionalist procedure if it's in the internal vessels, but this must have been an external vessel where a neurosurgeon could fix it.
But in life, sometimes when you get what you want, you end up missing what you left behind. Whether it's your roommate.
I'll see you in a little while. Okay.
Or time spent with your child. Or even the music you used to hear in your head.
No one wears makeup in the hospital, just as an accuracy fact check. Well, wasn't that just a lovely, lovely episode? I understand why it was the most recommended of all the episodes that I've been recommended. Thank you for all those who recommended it, and I know I got a little bit emotional there at the end. And that's what Scrubs does for me. It sneaks in, it lowers your guard by being funny, and then it hits home with some things about life and death, especially. And I feel like as I've been getting older and seeing more bad things happen, the frailty of life just becomes more real to me. And so it can be there's a lot of processing to be done, I guess. And this helps, and this is nice to talk to you guys about it. If you enjoyed this video, please consider supporting my channel by subscribing, joining it as a YouTube member or a Patreon, and check out the podcast as well, Doctors Getting Coffee, where we have big chats like this with different doctors across many hospitals in Australia. And I wish you all just an absolutely beautiful day, and I'll see you all in the next episode. Bye for now.